What is it? So this is a clinical illness that makes it harder for kids to breathe, typically occurring in kids under 2 years of age. It first affects the upper airways, resulting in fever, congestion, runny nose, followed by the lower airways, causing a cough, wheezing, crackles, and overall respiratory distress. What causes it? Viruses, most commonly RSV, respiratory syncytial virus. Others include parainfluenza virus, human metapneumovirus, influenza or the flu, adenovirus, and coronavirus, including COVID-19. When is the peak season? Fall and winter, October through March, in the northeastern hemisphere. Who is most at risk? So it's the leading cause of hospitalization in kids under 2 years, peaking in those 2 to 6 months of age. Risk factors include those who are premature at birth, who had a low birth weight, who are less than 12 weeks old, or contain any chronic diseases such as BPD, a weak immune system, or an abnormality in the airway formation such as laryngomalacia, a serious heart issue such as a congenital heart disease, or a serious neurological disease such as cerebral palsy. What happens to the lungs in bronchiolitis? The lining of the narrowest part of the airways in the lungs, called the bronchioles, becomes damaged and inflamed, causing swelling of the walls, with lots of mucus and debris sloughing off into the airways, therefore blocking them either fully or partially. What are the complications? So the one that we most fear is respiratory failure. This can happen in 5 to 10% of kids, and it's an inability to provide the body with enough oxygen. Dehydration. Apnea, so that means there are periods of no breathing whatsoever. They look like they're holding their breath. How do we diagnose? You need to describe the symptoms and be examined by a medical professional. An X-ray of the chest is rarely needed unless a complication is suspected. Blood tests, viral testing are actually not needed for a diagnosis, but can help, for example, in peak season if you want to diagnose RSV versus COVID. How do we assess the severity of disease? We categorize it into mild, moderate, or severe based on the respiratory rate, the effort, the oxygen saturation, episodes of apnea if they are present, lasting more than 15 seconds, the heart rate, the hydration status, and the peripheral perfusion, and the mental status of kids. How do we treat this? If it's mild, we use supportive care and anticipatory guidance. For example, keeping them hydrated, suctioning the nose boogers frequently, and monitoring them closely for worsening illness. They do not need antibiotics, and there's no current antiviral medicine for RSV. If symptoms of the flu are started within 48 hours, or they have underlying issues, remember they can have a medication for that. They do worsen before they improve, and you absolutely want to avoid decongestants and cough medicine because there is no benefit. Some red flags to look out for at home would be apnea, or holding the breath for more than 15 seconds at a time, cyanosis, which is a bluish discoloration of the fingers or toes, sometimes can happen around the mouth or the lips, but that is pretty severe. Having a poor appetite, so taking less than 3/4 of what they would normally eat, or having no wet diapers for 12 hours, or looking really exhausted. So moderate to severe disease. This needs to be assessed in an ER, and the majority will be admitted to the hospital for respiratory support, and this can either be with supplemental oxygen, with a mask or nasal cannula. Those with severe distress will need oxygen plus pressure support of ventilation. For example, with a high flow nasal cannula or things called CPAP, BiPAP. They'll need IV fluids, frequent nasal suctioning, often done with the powerful wall suction apparatus, which is pretty great. You may have a trial of inhaled bronchodilators, for example, albuterol. It does not play a significant role and really should not be used. Studies have shown that it does not change the outcome, although there may be some short-term benefits, but that comes with a lot of side effects. So some centers may still try just one. The cause of the wheezing is not that the airways are closing in from asthma, therefore relaxing the muscles and allowing the airway to open up doesn't fix the problem of inflammation and mucus clogging up that airway, so it doesn't really help. Some practices that have fallen out of favor over the last decades or so due to lack of supporting evidence are the use of hypertonic saline nebs. This used to be super common, but it has shown to not really help, unless they're in the ICU and they require the highest level of care. The use of bronchodilators routinely, for example, albuterol, epinephrine, the use of steroids, and antibiotics. So how do you prevent getting it, or if you have it, from being hospitalized? Basic hygiene measures such as hand washing, isolating from sick individuals, as it can spread through contact with droplets or secretions on clothes and on surfaces, really helps. So the RSV monoclonal antibodies such as Beyfortus or Synagis is actually super helpful. And vaccines such as those against the flu and COVID-19 if older than 6 months of age can actually reduce your risk of contracting it, or for it to progress to a serious disease such that you would need admission to the hospital.